Thank you for attending this breakout session. This session is filled with powerful information to help improve your health and empower you. Radio Free 102.3 KJLH. We are you.
I don't believe the future has to wait for the future. I destroy brain tumors with nanoparticles. I see breast cancer others can't. I create a biotech revolution with smart cancer drugs. I speed life-saving discoveries to life. I am the miracle of science with soul, and I live in City of Hope.
Hello, and we're so happy you joined us today. My name is Cameron Greening from Radio Free 102.3 KJLH as we celebrate another fantastic year of the KJLH Women's Health Expo. Now, of course, things look different at this time. We have pivoted to a digital platform, but the information and the quality of panelists that you will hear from today remains the same. So it is my pleasure to present to you the breakout session, All of Us, City of Hope's All of Us panel. We're going to be talking about some really interesting things, talking about community approaches. We want to inspire you to imagine what happens when we all work together, right? So we are joined by a fantastic panel of the next generation of doctors, physicians who have some incredible stories and want to encourage you with their knowledge of youth in science, as well as, again, building bridges in the community. So I am going to let these fantastic ladies introduce themselves, but we want to welcome everyone and invite you all in. And it is my understanding that you're all members of the Division of Health Equities. And so if you wouldn't mind, when you do your introductions, tell us a little bit more about your division. So let's begin with Dr. Lindsay Trevino. Good morning.
Hi, good morning, Cameron. I'm honored to be here speaking with you today and being a part of this panel. My name is Lindsay Trevino, and I'm an assistant professor in the Division of Health Equities, as you mentioned, at City of Hope. I'm a basic scientist, so I use cell lines and animal models to understand how adverse exposures to environmental chemicals promote the development and progression of cancer, including cancers that are pertinent to women, breast and ovarian cancers. And so that's sort of my background, and that's what I work on.
Fantastic. Welcome and good morning. Dr. Leanne Burham, who I'm seeing again after the KJLH Jazz Festival.
Yes.
It's nice to see you. Welcome. Good morning.
Thank you. Yes, as you said, my name is Dr. Leanne Burnham, and I'm a postdoctoral fellow at City of Hope. I'm a translational scientist that was hired by our founding director of our Division of Health Equities, as you mentioned. His name is Dr. Rick Kittles. And a little bit about him, he is a world-renowned geneticist. And for 20 years, he's addressed complex issues surrounding race, genetic ancestry, and health disparities that exist in certain populations. And then on the side, for the past decade, he's really carved a niche in looking at prostate cancer in Black men specifically, and genetic and biological reasons behind that. So he's hired a really elite team that not only looks at prostate cancer, but other diseases that affect Black and Latino communities. And so within that niche, I look at prostate cancer specifically, but he has a team of other physicians and scientists that are on this panel as well that look at different topics that are very important to our specific communities.
Fantastic. And thank you so much for that. And next we have Dr. Veronica Jones. Good morning and welcome.
Good morning. Thank you so much for having me here. Again, my name is Veronica Jones. I am a breast cancer surgeon at City of Hope. I have a joint appointment in the Department of Surgery as well as in the Division of Health Equities. And I treat breast cancer patients. So half of my time is devoted to treating breast cancer patients by performing surgery on them. And the other half of my time is devoted to research, specifically on breast cancers that affect Black women disproportionately. I focus on a type of breast cancer called luminal B breast cancer, which unfortunately Black women die from at about 4 times the rate as every other race. And so my research is designed to investigate why that is and what we can do to mitigate that mortality difference. I am delighted to be in the Division of Health Equities with so many talented researchers who are focusing on all aspects of cancer care across the spectrum. We have many members devoted to different topics, from lung cancer to prostate cancer, as Dr. Burnham said, to ovarian cancer to breast cancer. And so we are focused on discovering why disparities exist in all of these cancer subtypes.
Thank you so much. And last but certainly not least, we have Dr. Didi Tate. Good morning and welcome.
Hi, good morning, Cameron. Thank you so much for having me. Thank you so much for having all of us this morning. My name is Didi Akasiwa Tete. So Cameron's going to call me Didi throughout this presentation. She's not wrong, but I just wanted to provide that reintroduction of my name, because it does, it matters how we present ourselves.
Yes,
I'm a postdoctoral fellow in the Division of Health Equities. And like everyone has stated, the Division of Health Equities is definitely an eclectic group of so many dynamic leaders in research across medicine and the like. And my focus specifically is I'm a social behavioral scientist. And what I look at are the social determinant factors that impact our health as individuals, as well as our communities as a collective. So how does where you live, where you work, where you play, and even where you pray, and where you're born, how does all of those factors inform or impact how long you live and how well you live? So the quality of life that you ultimately will have being in the communities that you are currently residing in. So again, I am so delighted to be on this panel with all of these dynamic and wonderful women from our division. And if it, kind of our backgrounds, that doesn't give you a clue about all the other things that we have going on, we just have a variety of different disciplines that are all coming together to resolve the health disparities that are ongoing in our communities today. So thank you for having me.
Absolutely. And what a fantastic conversation this will be, specifically because you are really working in the community for people of color, for women of color, right? For Latino and Black communities, to really figure out how we can prevent and also understand how diseases move, right? And hopefully offer up some advice today as well to what you're seeing through your research and through interaction with patients and in the lab. So let's get started. The first question I have is, as researchers and as physicians, do you think you have all the answers to improve health outcomes of the communities that you serve? And that's a loaded question, because I think saying you have all the answers is kind of like, well, that's why we do research and that's why we continue to study. But I'd love your perspective and your lens from where you sit in terms of what you're doing and thinking about the communities that you're working with. And if you think that we are moving closer to gaining more information around some of the diseases that really impact Black and Brown communities, or do we have much more work? And let's begin with Dr. Jones.
So I think that the answer is both and. So we have learned a lot. That is the encouraging news, right? That where we are today is not where we were, say, 20 years ago in all of these disciplines. And I think there has been an increased recognition of the differences in different communities and how we handle diseases, how we handle drugs. And with that recognition, research has exploded. I will say, though, that we are at the beginning stages of that. So there is a lot more that we need to learn about how different communities respond to drugs, how diseases affect them. And we are going there, but we're at the beginning stages, right? We don't know yet how a certain woman will respond or a certain man will respond to a drug, and especially in the Black community, right? Yeah. Because historically, trials were done in communities that did not look like us and did not include us. And so only now are we starting to be more inclusive in our trials and in our research. And with that, hopefully we'll have more answers and decrease the disparities. But we have come a long way, but we have a long way to go. So.
Yeah, it's really good. It's very important what you said. And Dr. Trevino, what are some examples of the gaps you think in the knowledge, just building on what Dr. Jones just offered?
One thing that comes to mind that's very relevant to what I do is that cancer research relies on experiments with cancer-derived cell lines. So these cell lines are used in the lab to give us information about the biology of cancer and to help improve cancer treatments, and to also help identify treatments that may work further down the line. So really giving us the basic knowledge of how cancer works and what treatments might work to alleviate that problem. But the vast majority of research is conducted with cell lines from people with European ancestry.
Mm-hmm.
So there is limited availability of cancer cell lines from people of color. And those that do exist are not frequently used, or they are misclassified. So actually, Dr. Burnham was part of a study that actually looked at the genetic ancestry of a multitude of cancer cell lines that are used, and some of them were misclassified. And so they'll say, oh, it's a prostate cancer cell line, but it's a kidney cell line, for example. And so people are not being able to use the tools that they would need to answer the questions that Dr. Jones alluded to, that we just don't know some of the answers to. So there's a real need to develop ethically develop, I'll say. That's a whole other, that may be a whole other discussion, but to ethically
it can be part of the conversation today. It's up to you.
Right. So let me put out there to ethically develop diverse cell lines and use them to help develop effective treatments specifically for people of color.
Super important. Dr. Burnham, I wanted to ask you a little bit about what are some of the ways you're seeing as researchers and physicians that you're able to take what you learned in the lab and the clinic and apply it to patients in the communities that you work with. How can we ensure, and this, I'll also open this up to everyone else, feel free to jump in. How can we ensure that these necessary health education and disease screening opportunities are available in our communities, in the Black and Brown communities?
So it's one thing to work at the bench, right? Work in the lab, and even work with how Dr. Jones has her specific patients that she sees in the clinic. It's one thing to do that and stay inside of our bubble, but if you can't get that information out to the community, then that's not going to affect, individuals and families there. And I know most of us that are sitting on this panel and scientists and physicians of color got into this because we saw how our families were affected. Mm-hmm. And we saw how they maybe didn't have the best healthcare options available. So we wanted that to change. So that's how we got into this career in the first place. So what we do, and you got a chance to see that at Long Beach Jazz Festival last summer, is we bring screening to the community. The Division of Health Equities does that. And so we provide, for example, free prostate cancer screening in the form of a PSA blood test. So that looks at prostate-specific antigen that's circulating in the blood. We also provide a pulmonary function, lung function tests while we're there. And we want to bring that to the community because what we find is, for example, Black men are much more likely to get prostate cancer at a young age, and to more than twice as likely as to die from the disease. And they don't necessarily know that that's the case. There aren't symptoms till it's further along, so men are walking around healthy. They're not necessarily excited about going to the doctor and getting tested for prostate cancer, of course. So we want to kind of demystify the process, the simple blood test. So we bring in a team that looks like the community that we're trying to engage with. And so we have the nurses and we have volunteers that come and kind of explain the process. We provide the free cancer screening, and then we make sure that we get the results back to them within 2 weeks. And it's our ultimate goal to provide follow-up for them. And not everybody comes to City of Hope, and that's fine. We want them to be able to go to whatever is best for their personal needs and to be able to get that follow-up. So we go to the community and we hit it hard because we want to be able to catch disease in people that if you catch it early, it can be 100% curable. There's no point in having it go to where you have symptoms and you're sick and all this and you're stage 3 and 4 when you can catch something earlier and have a cure. So we are adamant about going to the community where they're at, as opposed to just sitting back and waiting for it to be too late when they come to the clinic.
That's fantastic. Dr. Tatay, I wanted to ask you about the role of community collaboration in improving these health outcomes in communities of color. So how do you work alongside with community members? What is your role?
Sure. Thank you for that question. So essentially, like if we look at how all of our disciplines operate, right, we're all in our own individual silos, so to speak. And to kind of respond to your previous question about do we know everything? It's no, right? Because of the nature of how everything is set up, the nature of how we're trained to have these visors on, so to speak, and not necessarily reach across the table, have conversations with other people that are of different backgrounds than what we've been trained in. And one of those visors that we have to take off is the lack of inclusion of community voices as a part of research, right? And an important aspect of that is you are working with individuals that are going back to situations, going back to their communities and have specific outcomes that are all surrounding them, that's informing why they're coming to you as a physician to begin with. And if we take them out of the picture and if we take their context out of the picture, then we don't have a full picture, right? So a lot of the work that I do as a social behavioral scientist, but also really as a community advocate, like I tell people all the time, and I say it jokingly, I'm really not a researcher. I'm a community advocate, like moonlighting as a researcher.
Yeah.
Because essentially what I see my role as is really being that connector and being that bridge between academic and the community, because we can do the research all day. We can stay in the lab and, test all the different experiments that we want to test, et cetera, write it up in these beautiful journals that take a very long time to get through the peer review process, and it finally gets published, but no one sees it and no one really knows that it's there. There's research that came out a while ago that says, essentially, once we publish everything into the literature, once we do the work, it's about a 17-year gap before that research is actually utilized and implemented. That is a problem, right? That
Absolutely.
is a major problem. What is the point of doing all of this good work if it's just gonna sit on the shelf? And one of my main, just my personal purpose for me personally is how do we bridge the gap between the great and amazing work that we're doing in the laboratory, the great and amazing work that we're doing, looking at epidemiological factors that inform health outcomes and improve health for all communities. How do we actually go back into those communities and provide that information in a digestible format, right? To say that, Black women are dying from breast cancer more than white women, what does that mean to an individual on the individual level? What can you do on an individual level? What can we do on a community level to reduce risks, such as exercising, changing your behavior, knowing your family history? All of those different dynamics are very, very important. However, if you are approaching the context from a perspective where people don't understand the language that you're speaking, that's a problem. And one of the main things that, the gospel that we preach as a part of the Division of Health Equities, like, Dr. Burnham stated earlier, we go where people are, and that's in the communities that they're living in. Those are the communities that they're going back to at the end of the day. So how do we as researchers, how do we as physicians, how can we bridge the gap between the amazing work that we're doing and then taking it back to the community and making it in a digestible format so that they can glean from all of the knowledge that we're learning? And that's really one of the key things that we'll tell you a little bit more about, that myself and Dr. Trevino have been working on for quite a bit. And that's been both of our backgrounds and really all of the individuals at Division of Health Equities, to make the work that we do translational. Like Dr. Burnham stated earlier, how can we translate the information, but not only translate it, but also translate it in a way that people use it and then change behavior, therefore improving the health disparities and improving health outcomes for this generation and generations to come.
And that's so important what you said about bringing it to the community. And Dr. Trevino, this building off of Dr. Tate's question, like, how do we bridge the gap to the community? How important is it to you to come into the community, to be able to interact? And what do we need to do to make things in the community, to make the community see doctors and scientists as more relational and less transactional? Like, what do we need to do that? I think Dr. Tate hit on some great points, but I'm still seeing a disconnect in communities of color. How can we bridge that, in your opinion?
Right. So I think one thing that is really important is to work within the scientific community. So as I mentioned, I'm a basic researcher, and my whole training has been in the lab, you know, with the cells, with the mice, with the animals. And I had very little opportunity to go out and, you know, educate people in the community about what I was doing and talking about how important it was for their health, or even learning from them about what was important to people in the community and what questions did they have about what we were doing. And because I think there's a curiosity, right? So everyone reads the news and then they hear, oh, you know, for this particular disease, you shouldn't do this or something, right? And then they go, well, is that true or is that not true? And there's so much information out there that it's hard. And so one thing that we've done, Dr. Tete and I, is really try to learn to speak each other's language. And so I don't want to put it all on the community and say, you guys need to come to us and you guys, no, I think that it starts in the scientific community, and it starts with us learning each other's language, learning what the community needs are, and then tailoring what we do to that. And so I've been learning through this project, the Bench to Community project with Dr. Tete, I've been learning how to present to the community what I do. And so instead of saying, we are doing a proteogenomic analysis of breast cancer cells, you know, I have to learn how to translate that. And the community stakeholders that we've been working with on this project have been absolutely phenomenal. I've learned so much from them. You know, they'll stop me and they'll say, wait, what? What do you mean by that word? What do you mean by this? How important is it really? And so I think that, you know, for me, I wouldn't put it all on the, you know, the community, but if the scientists and researchers really work together to learn from the community, then that can help build trust. And then we can go to the community and say, listen, I'm listening to you, because that's the most important thing, is that when you're trying to build trust, is I'm listening to what you're saying, and I want to help you learn, and so that you are empowered to make decisions about your own health and decisions about the health of your family and your neighbors, and to be a resource, right? So that someone can come to and say, hey, I heard about this, what do you think? And it's like, well, you know, here's what I've heard, because I've been interacting with these researchers on this project. So I don't know if Dr. Tete, if you wanted to go more into the specific project, or if Cameron had other questions.
Yeah, I do want to give Dr. Tete a chance to respond to that. And then I also want to go to Dr. Jones and Dr. Burnham and ask them the same question about the importance of bringing this to the community, and what they see are the gaps and how we can work to build the trust. So, but Dr. Tete, I'd like to give you an opportunity as well to jump back in.
Sure. So what Dr. Trevino was alluding to, like she stated, is the Bench to Community project. And what we've been doing is we are bringing our two worlds together. And so the basic science world, in addition to kind of like the community health world, like, you know, the social and behavioral context, the epidemiological context. And with this particular project, we have a group of community stakeholders that have been along this journey with us, right? Because ultimately the community is the expert on what they need. Ultimately, the community is also the expert on what's wrong. And a lot of times they also have the solutions, but may not necessarily have a particular skill set that we bring to the table to help them execute their vision of a healthier future for them and as well as the others around us. But for our particular focus, we're looking at reducing the impacts of endocrine disrupting chemicals on breast cancer and reducing that risk for Black women specifically. And the project is bringing in the context of what, you know, Dr. Trevino is doing in the laboratory and what I'm doing in the community, and bridging that gap. And it hasn't been an easy process learning the language of a basic scientist, right? I don't speak proteomics, blah, 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 blah. But
I don't speak it at all. So I'm like,
but the main aspect, just adding to what Dr. Trevino stated earlier, was we have to learn each other's languages, right? Because I have a doctorate in a specific discipline, in a specific entity. And one of the things that I've learned from, I admire all of these women greatly, because one of the things that I had to do as a social behavioral scientist was they allowed me to go into the laboratory and observe what they do on the day-to-day basis. I've had an opportunity to know what does, when they say I split the cell line to do this, that, and the third, I actually know what that means now, right? Wow. Because they have allowed me to enter into their space. And we have been, Dr. Trevino and I have been very intentional about disrupting some of those bridges and disrupting the silos that we've operated in for such a long time in order to make this Bench to Community project a success. Because ultimately it's going to take all of us coming to the table with our various gifts, with our various disciplines, with our various backgrounds, to really truly eliminate some of these disparities that's happening in our communities. And that's going to take, yes, it's not going to all focus on communities coming to the table, but it's also going to focus on, as researchers, bringing communities along that journey. And what our project does, and we're learning as we go, we're building, we're rowing the boat and building it at the same time. And we're learning from our mistakes, and we're learning from a lot of areas of improvement. We're also learning from our successes. And some of those successes is, one, as researchers in our various disciplines, reaching out to say, I don't really know what you do. So can I come into the laboratory with you and observe what you do so that I can ultimately learn a little bit of your language? And from Lindsay's perspective, can I come along with you as you have conversations with community stakeholders? Even that context of having a community stakeholders, those are individuals that have investments in the project. They want to see this project succeed because endocrine disruptors are essentially chemicals that are found in our personal care products that are increasing, that could potentially be increasing our risk for breast cancer and other diseases. But however, the area that I'm looking at it is, why are you selecting those products to begin with? But what Lindsay is looking at, okay, if you continue to select those products and these chemicals are in those products, this is what's going to happen to you biologically. We have to come together as a unit to answer that question. Are the products that I'm using, are they increasing my risk for breast cancer and other diseases? Like, we can't answer that question without each other as a collective. And that is the importance of the work that we're doing. When we talk about cross-collaboration, when we talk about working together across disciplines, it's going to take all of us, again, coming together to really answer some of these hard questions.
That's fantastic. Dr. Jones, Dr. Burnham, reactions, and also both of you working directly with the community, right? Going into the community, seeing patients, learning how to interact, again, helping to make that a relational, opportunity rather than a transactional sort of experience for them. Dr. Jones, we'll start with you. Reactions to Dr. Tate and also Dr. Trevino. What do you think about that? How can we come into the community and better serve the community? What kinds of things? Where are the gaps? And then we'll punt that over to Dr. Burnham as well.
Sure. I just love listening to you ladies.
Me too. I'm having a blast.
I just love hearing you talk. I could just sit here and be a spectator, the whole time.
I love it.
Yeah, you guys everybody's doing amazing work. And I'm honored to be on this call. As a physician, I do get to see firsthand how our research affects patients. And in fact, the way I chose my research path was based on my interactions with the community and my patients. And so I kind of went the other way, in that I was involved in patient care first, and research is much newer for me, probably than the other people on the call. But I do spend a lot of my time going into the community and talking to women about their concerns. I'm actually from South LA. I grew up listening to KJLH, so I am a native here, and it's just such an honor to go back into my community, like where I grew up, and talk to women about what is on their hearts in terms of fears about breast cancer, fears for their family, and I'm able to have dialogue with them about where we are in the breast cancer community. And then I take their fears, their concerns back with me to clinic and to the lab. And I'm able to, fortunately, in breast cancer, apply what we learn in the lab rather quickly in the clinical setting. And so, yes, there is a lag time between publications and how quickly we can apply them, but we are getting much better in that space, I will say, especially in breast cancer treatment, where what I'm learning today in the lab, I can immediately translate into a clinical trial at City of Hope, and then educate the community directly, maybe, that same month or the next month, about what we're learning and the new trials that are available for women of color. And so I think I have been fortunate to be able to navigate those three different spaces, right? Like go into the community, talk with women that maybe I grew up around, and then go to clinic and be able to provide them with the treatment, and then go to the lab and make sure that everything's lining up. And I think as long as I will charge let me just say, I will charge the medical field, meaning physicians, to come out of the clinic and talk to the communities that are in the areas that they serve, because we can get, I'm not sure who said it, if it was Dr. Trevino, Dr. Tete, we can have visors on and just kind of do our job, because it's hard, right? It's overwhelming treating cancer all day, every day.
Yes.
But you still have to take that weekend, take that nighttime to go talk to the communities. And a lot of times when it's hard, quite frankly, it's hard to treat cancer patients in clinic, I go into the community and I'm reinvigorated, re-inspired,
Wow.
and I have more to give in the clinic because of the interaction I had at a church on a Saturday with women who have gone through breast cancer or have fears about their mother, or things like that. So just for any medical professionals who hear this talk, get out of the clinic, get out of the operating room, and go into the communities of just your surrounding communities, and talk to women or patients or people, and hear what they need. And I think you'll be a better clinician for it. So
Thank you for that. Dr. Burnham, thoughts, reactions?
Yes, so I love what Dr. Tete said a few minutes ago about we're really moonlighting in our profession, right? So I think that these gaps that remain are really, that gap is going to close because of physicians and scientists who look like us, whether it's women or men, because we bring a vibe to the table that is not taught. You can't learn it in medical school. You can't learn it in the lab. And so we're bringing our whole culture, all of our experiences from the past with us. And we just happen to be good at science and math, right? And so then we just say, okay, what's the problem and how can we fix it using the skill set that we have? But at the end of the day, we're really round the way girls that solve problems.
I love it.
At the end of the day. So, I spoke about prostate cancer before, and I know we're really talking about women's issues, but the reason I was bringing up prostate cancer, that's my area of expertise.
Right.
And we as women, we're the gatekeepers of our family, and we handle their doctor's appointments and things like that. So that's why I really wanted to hit on that topic here. But as that applies to gaps that remain in research, for those that know me, I got into this because my dad was a Black man diagnosed with prostate cancer very young at age 50 with an aggressive form of the disease. And so growing up in Ohio, where I'm from, him being diagnosed there, me seeing all of the Black men in the community and at my church that were getting prostate cancer, and then I was looking, I would go to the hospital and look at my dad's care team and just be like, where's the Black doctors here? Like, do they really understand like what's going on? Do they understand how he's feeling at home, how these treatments are affecting him? Why are Black men getting this more frequently? And so I bring that to the table when I'm asking myself a scientific question, or even as Dr. Jones said, we're at City of Hope, we're a clinical trial mecca.
Yes.
We turn out some very cutting edge treatments all the time, but what the Division of Health Equities brings to the table is we're looking at ancestry specific clinical trials, or even known as race stratified clinical trials, where once again, it's, girl around the way sitting at the table, where I'm sitting with the team and I'm thinking, yes, this is a great drug by such and such company, but how can this affect Black men or Latino men who have a certain DNA landscape that we know that this drug actually may benefit them a little bit better than the rest of the community. So our voices are so important at that table to really, in a real-time, tangible way, get the best treatments to patients who could benefit the most. At the end of the day, that's just good science anyway, and it's being a good neighbor, to our community who is suffering disease at such a disproportionate rate as others. So I feel like those are ways I feel that we're bridging that gap.
This panel is just so empowering. I'm just so enjoying hearing from each and every one of you. You all are such beautiful representations and representatives of communities, Black communities, brown communities, power, showing how you're using your strength in the lab, using your strength in the clinic to be able to help community. I'm just speechless and looking at you all. Thank you so much. I just want to say that we're not even at the end, but I just want to say thank you, because what you've offered so far is just very empowering, I think. And thank you to the City of Hope for being cutting edge researchers and what you said, Dr. Burnham, about bridging the gaps, and what all of you have said about making sure that there's connectivity between researchers and physicians, and as women of color, really, being able to be a voice for community and stepping up and saying, we're not at the table, or we are at the table. Or have you thought about this from the lens of a Black and brown perspective, and how this could help, further a Black and brown patients' progress? I mean, all those things are super important, which is a perfect segue into the next thing I'd like to talk about, and that's opportunities, right? I'm looking at all of your faces, and I'm so empowered by seeing your faces and knowing that little girls, young women, seasoned women, seeing this panel are going to be able to say, wow, there's someone up there that looks like me. And so I can, go into a field where math and science is applied and not be ashamed. I am good at numbers. I do love science. I can make a difference and still remain real and relevant, right? Like you said, Dr. Burnham, we're around the way girls. Yes, we can't be that, right? Dr. Tete, we can't be that. And still be connected to who we are and to our communities. And so as we look at the data from the National Science Foundation, and we see increases in individuals earning doctoral degrees, what does that mean in terms of the representation in your respective fields? It feels like this moment in this nation, I know that we're seeing a lot of things going on, right? There's it's not new information to people of color at all, right? It's not new information to Black people and people of color. This is an experience that we are born into and that we live and that we're proud of for what that matters, right? We are proud of our heritages, but what can we do to encourage more Black and brown representation in your respective fields as scientists and as physicians? I know that there are STEAM programs, I know that there are STEM programs, but what are we really doing, and what can we really think about to help really kind of cultivate the next generation, seeing this as a real-time career and a possibility? Let's begin with Dr. Tete.
What can we do? Well, we can do a lot, right? We can, in terms of representation, it's the numbers are increasing, but they're increasing very slowly, right? So if you look at, there's a reason why it's only about 7% of people that look like me have a doctorate, and that can be, we can go the racism discrimination route, Because if you've ever finished the doctorate, if you go through that process, it's not necessarily meant for everyone to survive that process. It's not necessarily meant for everyone to get through that pathway and come out with their minds intact. You know what I mean? And it's difficult a lot of times when you're in a lot of these spaces, and when you look around the table, right? You know, Dr. Burnham alluded to this earlier. When you look around the table and you don't see someone that looks like you don't see another Black man, you don't see another Black woman specifically that looks just like you. And that cultural context is then not at the table. That cultural context is then not provided as a part of the conversation. So one of the things that for me that I can do as an individual, as a Black woman that is navigating these very interesting academic waters, is to not give up, right? Because, and if we, can get real for a second, this process has not been easy. This process has not, it's tried my faith, it's tested a lot of who I am, it's tested a lot of this, skin that I lived in. But give up, right? And that's oftentimes I have to continue to tell myself to keep running this race. I can't give up, because at the end of the day, what happens in our society is that the individuals that are sitting at the top, what do? They bring along the people that look like them. They bring along people that's in their communities that they've had conversations with. They bring along people with them that oftentimes look just like them. So as individuals of color, as people of color, when we've gotten to a certain point in our career paths, like, we have to continue to run this race, because ultimately what's going to happen is that I'm going to pass that baton to somebody else that looks just like me. Right. I have to pass the baton to someone that doesn't have the esteem right now to continue running this race, because they've been so beaten down by the system itself that they want to quit. But however, I have to continue to get my community around me, right, to support me in running this race, because I have to pass the baton. I have to bring more people to the table that look like me, that represent my communities. There's a quote, I don't know if it's famous, but it's been around the block. And oftentimes it says that, if you're not at the table, then you're on the menu. Like, what does that mean exactly, right? Wow. If you're not at the table, that means you're on the menu. So if a lot of us are not invited to some of these tables, right? But what I love about the women that are on this panel, what I love about, the Black and brown women that are at this panel, is essentially, if you're listening to our backgrounds, if you're listening to kind of where we come from, we're essentially saying, you know what, it's okay. You don't have to invite me to your table. I'm going to bring a chair anyway. It's okay. You don't have to invite me to your table. I'm going to build my own, and then I'm going to invite other. Right. I'm going to build my own table. This is what we're going to do here. I'm going to build my own table. So what we're operating in right now, when you ask, what is it going to take for us to increase representation in all of our various disciplines? What it's going to take is you. It's going to take you being whole enough. It's going to take you doing all the things that you need to do to continue running this race, because at the end of the day, what's going to happen is you eventually have to pass that baton. And what I mean by passing that baton is you eventually, even in the spaces that you're operating right now, you have to mentor the next generation that's coming up. You have to invest in what they're doing. You have to mentor the generation that is coming before you. What does that look like? That looks like picking up the phone, sending a text message to check up on our young people, especially right now with everything that's happening. It's so easy for us to lose hope. It's so easy for us to say, you know what, what's the point of all of this? I feel like we've been here before, but the reality and the hope in that factor is that when I look across this panel, this is my motivation to keep going, right? When I look at all of those Black and brown and white and all the things out there protesting, the systemic unrest and the injustice that's happening in our nation right now, that keeps me going, because at the end of the day, no matter where you are, no matter what discipline that you are in, if you don't have a doctorate, if you do have a doctorate, wherever you are in the spaces that you operate in, continue to run that race. Make sure that you are good in that space so that you can pass that baton to that woman, to that Black girl, to that Black boy, so that they can come along this journey with you, so that we can all get at that table, or so that we can contribute to building another table of our own, even if we're not invited to the ones that have been making the decisions for us, about us, but without including our voices. I'm a stop talking and just leave it right there.
Ashe, I appreciate you saying that. Right there. You're keeping it real, and I appreciate that. Dr. Trevino, same question. What is your thoughts about the whole concept of reach, teach, and grow, right? How we have to really help inspire, and what you're seeing from your lens around representation.
Right. So, I mean, oh man, Dr. Tete put it out there. And she said everything that we all feel, right? That we all feel, and we all
finger
think
snaps
about, and we all struggle with. I know. I was like, oh, girl, yes. So, what I will say is that, so I echo everything she said, and I do want to say one thing. We're not saying that if you're not a person of color, that you don't have value in doing this, right? So we're not saying that, okay, if you're not Black or brown, then get out the way because we're mowing you over or whatever, right? Because we do need allies. There are not enough of us. There are not enough of us, really. But we need allies who mean it, and allies who get it, and allies who understand. But representation is super important because, you know, I was usually the only Latina in my program, you know, going through my training, and I made it through, but it would have been nice to have somebody that I could talk to who had been where I had been, who had seen what I had seen, who had gone through some of the things that I was going through, to just be able to say, hey, did this ever happen to you? I mean, was that weird? Is this racism? I mean, how do I deal with X, Y, or Z, right? And so it's tough because there's so few of us. And so it's always a burden at our institution sometimes that we're the ones that are the go-to. You have to fix this problem. You have to do this. You have to do that. But as Dr. Tete was saying, as tiring as that can be, we still have to be there, and we still have to come to the table, because without us, that those things won't happen. And so, you know, it may not seem like it, but I don't like to talk to people that much. Like I'm a more reserved type of person most of the time. But I feel that it's really important to get out and talk to the community, and to be a representation of what you could be, right? So when I was very young, and I was early on in my training, I was doing things where, you know, we did science fairs in the community at local schools, and I was doing all this, you know, going and presenting, and I would wear a lab coat, and I would say, look at me. And I wasn't a PhD yet, right? I didn't have my doctorate yet, but it was one of those things where it was just trying to show people that it's okay to love science. It's okay to love math. It's okay to want to help your community in a way that people maybe don't think about, because not a lot of people are aware of, you know, getting a PhD. Everyone knows about the MD, but getting a PhD and doing research, what does that mean? I grew up not knowing anybody who had a PhD who looked like me. So it's more about, can we go out there and can we share our experiences and be real about, it's not easy. And sometimes you want to quit, and sometimes you're on the verge of just saying, that's it, I'm done. But then you think about how, I mean, I love science, and I love the research I do, and I love that I'm learning how to reach out to community and really make a difference in people's health and lives, and just everything. And so it's a tough question. And a lot of people do research to try to figure out what's the easy way to do it, or what's the best practice, or so it's kind of you know, this is a whole session on its own, sort of, but I echo everything that Dr. Tete said. And I think that everybody on this call, everybody on this panel is a perfect example of how to keep going, and how to keep moving, and really they're inspirations to me, for sure.
Yeah, no, thank you for that. Dr. Burnham, same question, and especially because you talked a lot about your upbringing and seeing community and wanting to make a difference based on what you were seeing, from your father's example, from examples in your church. What does representation mean to you in terms of making sure that our young people and that communities in general see faces of color?
Yeah, so I feel it's so important to reach back and really mentor people who are interested in doing what we're doing. What I find is, especially in this age of social media, is I always have younger women reaching out and saying, "Oh, that's so cool what you're doing, and how can I do that?" And I never turn somebody away in terms of just setting up a call or something and just kind of seeing what they're into, see what might fit best with their lifestyle, their personality, what's going on. Because a lot of these girls have great ideas and they just need to get through the process and get the credentials, because I feel like a lot of the things that I'm putting into action right now has been in my head for like a decade. But you're sitting in a meeting and you're saying it and everybody's like, "And you do what? Your title is what?" And so it's like, then once you get the degree, then it's like, okay, now, let's take it more serious. So it's just so important to get all of these young people that have these great ideas to just make sure they get through the process. And unfortunately, the way that our society is set up, a lot of times students of color have a lot of extra academic things going on. They need to be extra mentored, because I know even for me personally, you're not just, class is like the least of your worries. It's like, okay, I can do well in the class, but I've got this going on at home, this going on with my bills, this going on with this uncle is sick with this. Like there's just all of this outside influence that sometimes can be a little bit more intense. And so to me, it's about mentoring the whole person and helping them to navigate those other things and stay focused on the academic route, because, it's worth it in the end. But like Dr. Tate said, it's grueling, but you get there, and it's important to get there because the ideas are there. And like Dr. Tate said earlier, she goes into the community wanting to ask them what they think, because they already have the answers. So there's people there that already have the answers, and they just need to get into those positions where they can make a difference. So to me, mentoring is huge, and reaching back and bringing young people alongside us.
Absolutely. And Dr. Jones, you're also on the front line, seeing patients and really helping to educate them on their journey of breast health. What about representation, given what your background and kind of your studying and just your journey? How has representation played a factor into that, and why does it matter so strongly or not to you?
Yeah, no, it matters a great deal. And I think, Dr. Burnham put it best when she was going with her father to, seek treatment, like, where are all the people of color who are physicians? And that is how I have felt going through my training, where I was the only Black person, in a department, or the first Black person to be hired in a department. And it's been lonely. There are not many physicians of color. I mean, I know, like Dr. Trevino said, everybody knows about the MD. Our numbers are dismal. I mean, wow. I want to say 3% of all physicians in the country are Black women. 3%. I mean, we don't have a lot of representation, which is what motivated me even to go into medicine in the first place, because I was finding I did research in college about how different diseases, specifically infertility, affect Black women, and how we, if people of color, interpret a disease, how we deal with it, how we think about it, how we think about ourselves in the context of a disease. And I found that one of those barriers were people just didn't trust the medical field. There's a lot of mistrust there. How do I know that you're going to take care of me? How do I know that you have my best interests at heart? How do I know that you understand me? How do I know that I'm not going to be a guinea pig? And all of those are founded. There's a reason that people of color feel that way. And so I took it personally to try to bridge that gap, to be in the medical field, to be representation for my community in the medical field, and to break down that barrier. when it comes to inspiring other people, younger people to go into medicine. Like Dr. Burnham said, mentoring is key. I think that we as, clinicians and researchers of color need to be in the community so that people can see us and know that it's possible, know that the barriers do exist, but you can get through them. And we need each other. We need each other to get through those barriers. So I just think mentoring is key. Representation is key. I mean, we're not going to move very far if we don't have representation in all of these fields. We need to come together and just keep it moving, because it is difficult. It is very difficult to be in this space. So,
absolutely. I have enjoyed you ladies so much. I do have one final question before we close, and I just want to show gratitude to you all. I look at you all as first responders. You may not be in an emergency room, but you are first responders. You are dealing with patients who have some very critical issues. You are in laboratories conducting cutting edge research that's going to help us in the near future, in the immediate future. And so I just want to thank you for your service as doctors, as scientists, as physicians. You all play a very key role in the future in helping folks to understand, and also seeing your smiling faces, breaking down those barriers, like you said, Dr. Jones, of mistrust, right? Being able to see your faces and know that these careers are possible is empowering to me, and I know will be empowering to the women who are watching this panel. So I thank you so much for your time, and of course to the City of Hope for allowing this opportunity, and really the wonderful work that's being carried on there in the vision. I would like to ask you all to land with this question. If you could go back in time and offer some words of wisdom to your 8-year-old self, to your younger self, about your educational journey, what would you tell her, right? Thinking about what you know now versus who you were then. What would you tell her? Let's begin with Dr. Trevino.
Oh, let's see. So when I saw this question, I was like, that's a good question, but what am I going to say? I think what I would say to my younger self is that don't let external voices stop you or get you down. You're good enough. You're where you're at because you're good enough. You work hard. You're smart. It's okay that you like science. You're not a weirdo, right? So like, you hear all these things, oh, you're a nerd or whatever, right? So there can be a lot of negativity that comes externally. Even though you're in a community that is supportive, there are still going to be some people that you come up against that think, well, why do you think, like Dr. Burnham said earlier, like, who are you? What you have an opinion? Why? You're nothing. And so I think I would say to a younger self, you're going to hit that, but don't worry about it because you'll get through it. And so, don't really internalize it or listen to it too much. But that's hard. And it's something that a lot of people of color struggle with in terms of, am I good enough? Why do people think I'm, I hear all these incredible things and I'm like, wow, she's incredible. And someone says, well, so are you. And I'm like, oh, am I? And so that would be something that I would say is that you're good enough. Don't listen to all the negative and just keep pushing because it's going to be really great and you're going to be where you need to be. And I'm so honored to be working with these women. And so I feel like it was all worth it to go through what I went through. And so that's what I would say.
Great. Dr. Tate.
Yes, you are good enough. You're a boss lady, Lindsay. Like
all of you are, absolutely.
Boss lady.
Indeed.
All of y'all are boss ladies.
Indeed.
So when I looked at this question, truth be told, the first thing that came into my mind was, you is kind, you is smart, and you is important. Right. And I think all of us, if you haven't seen the movie The Help with the fabulous Viola Davis, this is not an ad. I just think she's awesome.
Yes, she is.
But it's, I think one of the things that I remind myself of are really honestly those three words. It's, you know, Lindsay alluded to this earlier. There's an element of negative self-talk, right? That we operate in on a daily basis. I'll just speak for myself. And it's oftentimes like you have to combat that with things that remind yourself of who you are. Like you are wonderfully made, you know what I mean? And I think for me personally, like I have to constantly even remind myself of that, like remind myself of whose I am, you know what I mean? And ultimately I am a child of God, and that is enough, right? But, you know, on a daily basis, you know, Mau Eligbo, you know, and that's translated into my, you know, my native tongue is like, God is with you, right? So no matter what the situation may be, run your race the way that you've been designed and you've been created to run it. Operate in your purpose, because can't nobody be me, right? Can't nobody be you. And ultimately there are giftings in you, there's purpose in you that only you can operate in. And you know, I'm saying this is what I will say to my 8-year-old self, but this is what I tell myself on a daily basis.
All the time.
You know what I mean? All the time, because it's like you have to constantly remind yourself of who you are and whose you are. So to my 8-year-old self, and even to, you know, my 33-year-old self, even right now, it's, you know, don't compare yourself to other people. Comparison is the theft of joy. Run your race like you were meant to run it. And God is with you. Keep doing you, keep trucking, because ultimately at the end of the day, keep doing you. Like if you don't get anything out of this entire panel of these beautiful Black and brown women, if I can just leave you with this, like you have all that you need to be what you've been created to be in this world, and you are needed, right? I am because you are, like Ubuntu, like know that can't nobody be you. And if you can show up into these spaces that you oftentimes won't find people that look like you, but if you can stay in that truth that you were there for a particular purpose, you made it to do something, right? And stand on that truth, no matter what you are, no matter where you are, no matter what you're doing, then keep doing that, keep running that race, because ultimately what's going to happen is you showing up as your full authentic self and all of its glory is going to give somebody permission to show up as they truly are as well. So that's what I would tell my 8-year-old self then, and that's what I would tell myself today.
Dr. Jones, same question.
I don't know. I think I just want to give Dr. Tete a mic so she could drop it.
Drop it.
You know, I just want to virtually hand you a mic and we could be done. I mean, that was well said. I might just have the other women on the panel speak to my 8-year-old self and encourage her some. I echo all those sentiments. I don't think that I could add anything else. I think I would just, have them speak to her, and then tell her also that, you know, she's loved. You know, this is hard. It's hard to live in this world right now, just being honest. Yeah. It's hard to be a professional, be a physician, a researcher, be a person of color. It's been hard. And I think I would just tell her, I think similarly to what Dr. Tete said, it's you're enough. Even if you don't, I know that's probably not what I should say to her, but even if you don't become a physician or, you know, do the things, you're enough. And what you have to contribute is enough. And it's just because you're loved and made in the image of God. Period. End of story. You know, that your value doesn't come from what you do. And I would just want her to rest in the knowledge of being loved. Beautiful is a beautiful child. And so to everyone on there, you are enough, you are loved. You don't have to have the title or anything to be so valuable. So.
Dr. Burnham.
Amen.
So my high school advisor told me, Leanne, you've got really good grades, but you should not go into science or medicine because you just are too bubbly and you like to have fun and you're not going to want to be in the library all the time studying. And so I put off pursuing this career for a decade. And then I went back to it and I realized, no, I can put in those hours in the library. And if it wasn't for this personality, I wouldn't be in this position I'm in now, where I'm able to effectively work in the community and network with others and work, with great teams like we have at the Division of Health Equity. And so I would say, if you have a dream and you have the skills and do what you're passionate about, keep going for what you're passionate about, and everything will fall into place. Like, no matter what the haters and the naysayers say, just do what you're passionate about and then it'll fall into place. And so obviously I didn't listen to certain mentors then, and it kind of delayed everything, but everything happens for a reason. But just go for your goals. If you know you have what it takes, then just pursue that passion.
My gratitude again to each and every one of you, sending you so much strength and power in this moment. You all have inspired not only me, but the women, I'm sure, watching this session. And so I thank you. I thank the City of Hope Health Equities Division again for allowing this opportunity, you all to share your wonderful journeys, your perspectives, your personal stories. I thank you for being so transparent. I heard how the importance of cross collaboration between science, between physicians, how we need to work together. You're really on the same team, right? So that's important. And going into the community, right? Whether you are in a laboratory or in a clinic, speaking the language of the community by way of helping them understand the impact, right, of their environmental factors, of how they've grown up, what they can do to prevent certain things, speaking their language and coming down to their levels to create relationships, right? So it's less transactional. But I also heard someone say it's going to take all of us, and that is the title of this session, all of us, right? And it will, and it does take all of us. Trust in physicians, trust in science, trust in the community, but together we can.
The KJLH 20th Annual Women's Health Expo at KJLHradio.com, presented virtually by RastAfri and Radio Free, KJLH.